Care is a paradigm shift. In the past, we used to think that healthcare can only be delivered by professionals who are highly trained, and particularly in intensive care settings like the NICU. In Care, we are bringing families in to become part of the care team, where they are the primary caregivers. That's a shift, a big shift in thinking, a paradigm shift. Essentially, it says that we've made a mistake. It cannot be that only professionals can provide that care. In fact, families have a very important part to play in the care of the baby. And they do that through participation in many things, in providing the care itself, in providing insights into how the baby is doing, because they are the ones who are closest to the baby on the daily basis and know the baby really well. By discussing with the doctors and nurses how best to care for their baby, and by also involving themselves, they are contributing not only to the welfare of the baby, but actually also enhancing their own health, because the family is also affected by the baby's illness. It also gives the doctors and nurses a very different perspective of how to interact with the families and how to care for the entire family as opposed to just caring for the baby. So it's a big shift in thinking. I think, first of all, that we have to change the culture of how doctors, nurses, and other health professionals interact not only with the families but with themselves, so that they can better integrate and embrace the role of families in the unit and in the care of the babies. That's the first thing. The second thing is that they have to think about how best they can use this new way of caring for babies to support families, and how families can also support themselves. Because we are finding that a lot of the families interact on a very different level, and they provide mutual support in a way that we never saw before. And this carries on beyond the NICU, so that that kind of support interaction will have enormous benefits beyond the NICU in the lives of the babies and their families later on. And finally, I think that this is a concept that needs to be embraced by all the healthcare system and not just by the NICU. We don't have the results of the full randomized controlled trial yet. The pilot study certainly suggested there were a lot of benefits that could be seen. The babies grew faster. There was less morbidity in terms of infection, eye disease, lung disease. There was increased satisfaction among both caregivers and parents. There was decreased stress, and there was increased breastfeeding. So all the results were beneficial in terms of the pilot study, and we'll see what the full trial shows. I think what was most surprising to us, which we did not expect, was the engagement of the parents, because we thought that there were going to be limitations with respect to how many families can actually participate in this and can commit the time to do so because of other obligations. In the pilot study, we found that 80% of all eligible parents actually participated or wanted to participate. What it suggests is that there is a broad support and interest in this. And so I think that going forward, we will be able to make sure that the program can embrace all families that want to participate in such a program. Well, we are very lucky in Canada because we have a lot of resources. In many other resource-constrained settings, in countries that are less well-developed and less well-endowed, they have a real shortage of healthcare workers and particularly nurses. And in those settings, when I speak to my colleagues in those countries, they say, well, we bring in parents all the time to look after babies. And so this model is something that can really contribute to their healthcare. And we are seeing that already. For example, in China now, there is a big trial going on with using Care to see how they can involve families in the care of their babies. So I think this will have huge worldwide ramifications. I think that this will cause people in all areas of healthcare to ask themselves, have we got the model right in thinking that healthcare is something that health professionals direct and patients comply? I think it has got to be a partnership, where in fact families, patients, in fact are deeply involved in their care and take a much greater role in terms of caring for themselves.